health. I want to thank you all for tuning in, those on Facebook Live, and I really want to say thank you to the media for being here with us today. As always, I want to give just a great thank you to our board, or to our mental health team members, and the great work that they do every single day, and the support that they provide our region. I'm always amazed and appreciate the great work they do every day. We are hoping for a slowdown in our current surge, and then we have seen a leveling off of some inpatients, but unfortunately we have seen an increase in deaths across the region. As a fact, this past weekend we saw 23 deaths in one weekend, which I believe is the highest number for one weekend for COVID-19. As in any of these pandemics, and this pandemic we've been dealing with, we have peaks and valleys with this, and we see many times that the peaks are being fueled by people who are not vaccinated and have not had COVID-19 before. And so it really does create increased admissions to the hospital. So let me share with you the scorecard today. And so we have, we're treating 396 patients in our hospitals today. That's 17 fewer than the peak that we had last week at 413. We don't know if 413 is going to be our highest number as of right now. We don't think it will be because we are seeing a pretty steady number of positive cases across the region. So judging by the testing and by the total number of cases that we're seeing, we expect that we will go back up over 400 in the coming weeks here. We're treating 104 patients in our intensive care unit today. That's 4 more than we had last week at this time. We also have 79 patients on a ventilator. That's also up by 7 from last week. These are critical patients, obviously, and they obviously take more resources and care and monitoring. This is pretty much in line with what we've done for several weeks now, and that is the Delta variant hits a lot harder and is more difficult for people to overcome than the earlier strains of the virus. That's really why we're seeing an increase in record numbers in our ICUs and on ventilators. On Monday, we did reach a new record of patients in our ICU with COVID-19. We had 112 patients on a single day. We also had a new record, unfortunately, of patients that were on ventilators. We had 84 of the patients that were in the ICU on ventilators. Today we have 24 patients under investigation, so we continue to test quite a bit on a daily basis. One, I think, positive data point is we only have one pediatric patient in Nice River Children's Hospital at this time. It's down from 8 earlier this week. Unfortunately, it is one of the lowest numbers we've had in recent weeks, so very good news there. Sadly, we are treating 3 mothers who are pregnant mothers with COVID-19 at the time. We have learned that this virus can be very dangerous for pregnant women, so this is obviously very concerning to us at this time. Additionally, we're treating 259 patients through our Safer at Home program. As you know, this has been a very successful program in taking care of people in their home environment. We also, by treating that many at home, our total patients that we're caring for is 679 now across the region. Our positivity rate has stayed pretty high at 22.3%. And as I mentioned earlier, we are seeing significant deaths in our region, 49 over the past 7 days. So the thing we're finding out is in September, 1 in 3 or a third of the patients that are expiring across the system are due to COVID-19 issues. Just yesterday, Tennessee reported the highest single death toll since February, with 128 COVID-related deaths in the state, and 2 of those were people within the age of 11 and 20 years of age. For these families, this is not a statistic. We provide a lot of statistics, but this is not a statistic. This is a loved one or a friend, and regrettably, it could be a child, as we saw this past week. The reason we expect really cases to grow deaths actually increases due to the large number of cases we're seeing. We did see an increase week over week in total number of cases across our region. And so let's take a look at the data that we have. So you can see we had a pretty steep increase week over week. I will say that the state of Tennessee did populate additional data towards the end of last week. We think it was a little bit of a catch up from some prior weeks. But from what we can tell, we still had an increase. This shows an increase of about 30%. It's probably closer to around 15% of an increase week over week, but still pretty substantial numbers that we continue to see. And then I think we did feel some relief this week in some flattening of our inpatient cases. We dipped down to 388 a couple of days ago, back up to 396 today. We still see that the ages of people in the hospital are between the age of 40 and 69. Overall, the average age is right at 60 years of age. Those who are vaccinated are at 72 years of age. The unvaccinated continues to be considerably younger at 59 years of age. And then the monitoring volume for the Safer Home program, as you can see, continues to go kind of up and down, but we still really believe this is a very successful program to care for people in their home and does not put additional pressure on the hospital setting. Also, we've talked a lot about monoclonal antibodies as a therapy that is very important for us. We really do believe that this is helping because of the additional monoclonal antibody therapy we're providing across the region. Not just us, but other providers are also providing this therapy. It really is helping us decrease the number of patients in the hospital. And so you can see the last 2 weeks, 329 last week, and then 311 this most recent week. Since December of 2020, we provided over 2,200 cases of the monoclonal antibody, or 2,200 doses of that therapy. And so we do think that treatment is very successful. And again, there are other providers across the region also helping to support this. This is just comparing the surge from last year to this year. And you can see the current surge is 396. We're starting to see a little bit of flattening, but we also saw similar flattening happen last year before we hit our peak of 361. So it's not exact. So we do have peaks, like I said, peaks and valleys that happen with this. So at 396 here, and we're hoping for flattening. I'll share a additional modeling with you in just a moment. So again, unfortunately, we are seeing an increase in deaths, especially August, and then so far in September, right at 1/3 of the patients that are expiring across our facilities are due to COVID-19 related illness. This, by the way, 32.6% is close to the highest we've seen since last January. So we're right at that highest number of deaths as a percent as well. And then our positivity rate, we did see a drop a week or so ago, but we have now seen a net uptick of 22.3%, so back up higher than where we were. We do see that, again, some of the higher positivity rates from counties like Carter County, Greene County, Hawkins County, Washington County, Tennessee, and Sullivan County, Tennessee are at 20% or higher. And so that's where we're seeing our highest positivity rates. Again, we're at 22.3% right now. From the vaccination front, we're seeing that we did inch up 0.1% at 40.5% compared to last year. You can see the ballot service series at 47%. Compared to Tennessee, partially vaccinated, fully vaccinated, we're at 40.5. Tennessee's at 43.2. Virginia is significantly higher at 58% now. And then the modeling that we do, again, we had 8,000 cases. I think the good thing I like about this now is our modeling getting a little tighter than the numbers that we're seeing here out for the next 2 weeks. Remember last week we were seeing maybe over 700 cases inpatient. We are seeing that tighten to somewhere between 350 and 530 cases. And then 2 weeks out from now, 370 to 557 cases. So we do think that's getting a little bit tighter in that number right there. Unfortunately, we are expecting to see, again, some higher and more increases in our deaths over the next 2 weeks. And then this compares our actual data, the purple here, to our modeling numbers. You remember this red was really the worst case scenario. The yellow was with moderate attention to the things we talked about through mitigation. And then the green is really actively mitigating what's going on in our area. So fortunately, we're running closer to the low estimate that we have looked at before. And so hopefully we'll continue to see us running in this lower and even see an increase in some coming weeks here. What we have seen is in Virginia and parts of Tennessee, other parts of the state, that there has been some flattening and decreases in cases. And so we're looking at that through our modeling opportunities. Okay, just to switch to federal vaccine mandate. I'm sure that you all have seen and heard the Biden administration announced plans for a new vaccine and COVID-19 testing requirements this past week. There were two major impacts to ballot health through this mandate. One was if you're an employer with 100 or more employees, or if you receive and participate funding and participate with Medicare or Medicaid, you would fall under one of these mandates that's been proposed by the Biden administration. And what it said was it would require either a mandate you would either need to be vaccinated, or there would have to be routine and regular testing have to happen to your employees. For now, we're going to wait and see how the rules are finalized and completely written before we take any action on this. It does impact us because we do have obviously more than 100 team members, and we do receive funds and participate in Medicare and Medicaid. For now, we're listening to our team members. We have advocates on both sides of the mandate issue. Our goal is unchanged at this point, and that is to get as many people vaccinated as possible. And we try to educate all of our team members and the community on the benefits of receiving the vaccine. Jamie will share with you again really what we're seeing in the hospital is predominantly and overwhelmingly people who are not vaccinated. Ultimately, we're advocating for everyone to get the vaccine and take the shot as soon as possible. But for now, we're not announcing any new vaccination policy for our team members or physicians. I'll also add, we're right at 63%, I believe, vaccinated for our team members. Our medical staff is around 97% vaccinated. So any decision that we make moving forward will be obviously in accordance and working with the federal government and the guidelines that they are putting forward. I want to address something really positive that happened this week. We had a mission moment. Connor Begley, who has been a patient with us, this young man has been with Nice Longer for over 44 days, was able to leave the hospital this week, yesterday. Connor is 16 years old and was discharged after battling COVID-19. It was obviously very emotional, not only for just the Children's Hospital members, but everyone within the Valley community. We have obviously been praying and hoping for the best for Connor and his family for some time now. And so we had a victory walk for Connor yesterday. And if I could, I'd like to share that video with you at this time. this truly was a miracle, and we're so thankful that Connor got to leave the hospital this week. There were a lot of prayers and support for he and his family. We continue to pray for them, and just wish the very best. This young man was very, very sick for a long time, and so we're just so thankful that he got to leave the hospital this week. So it gives us all hope that we can work through this, and that's what we really have to hang on to, is that every day that we are continuing to treat our community, and we wish the best for them. We would obviously encourage people to be careful when you need to social distance appropriately, wear a mask when you are in crowds, and most importantly, if you can get a vaccine as soon as possible so that we can really stop the spread of COVID-19 across our region. At this time, I want to turn it over to Jamie Swift, our Chief Infection Prevention Officer, for some additional comments. Jamie?
Eric. As always, I want to start with thanking our team members. It continues to get harder and harder out there, so thank you all for what you're doing, and thank you all for being here to help us share their stories. As Eric mentioned, we truly are nowhere close to being out of the woods just yet. Our team members are exhausted. They're witnessing horrible sickness and death every single day, and it's hard because it's preventable. At this time, we'll share our patient status slide that we have started sharing. So as of today, as we've shared, 367 of the 396 patients are unvaccinated, which is at about 92%. That percentage is even higher for our patients receiving critical care. 98% of our COVID patients in the ICU are unvaccinated. And 77 of the 79 patients on a ventilator for COVID-19 are unvaccinated. As Eric shared, the average age of our vaccinated patient is 72, while that drops down to 59 for our unvaccinated patients. It truly is disheartening. Many of us behind healthcare walls are stressed and overwhelmed beyond belief. There are more than 8,000 new COVID-19 cases per day in the state of Tennessee, and hospitals across the South are stretched to and sometimes beyond their limits at this point. It doesn't have to be this way. We can turn the tide today if we get everyone vaccinated who is able to get the shot. Today, I come to you simply asking a favor of each of you watching or listening to us right now. First, if you're vaccinated, thank you. And the favor that I ask is this: find one person in your life who is unvaccinated and have a serious conversation with them about why you would like to see them get vaccinated. They undoubtedly will have questions or concerns. That's understandable. If you don't know all of the answers, please send a message to Valid Health on Facebook and we will help answer those questions. I ask you to go into that conversation with an open mind, not in any judgmental way, sharing why they are important enough to you that you want to have that conversation and why you want them to stay well and remain in your life. My second favor to ask is for those who are listening and may not yet be vaccinated. Please, I truly beg of you to turn to a trusted source for medical information to learn about the vaccine. Don't be afraid to ask questions. That's why we come here every single week, with hopes that we can reach at least one more person to calm their fears and help them take the step to get that vaccination. I ask that you keep an open mind and think about your role in all of this. Think about how you can help protect those who are immunocompromised, struggling with heart disease, cancer, diabetes, obesity. Think about the healthcare workers in our region and what it would mean to them for your support. If we all do our part, we truly can return to a normal state. None of us want anyone else to find out just how serious this virus is in the way that many find out within the walls of our hospital. Valid Health continues to offer the vaccine for our community at our vaccine site at the mall. The center this week is open from 2 to 6 on Tuesday, Wednesday, and Thursday. We're also still offering that third dose for immunocompromised patients at that site. I want to turn quickly to monoclonal antibodies. So there truly is no substitution for vaccine. But fortunately, in the last year, there have been the development of treatment options with the monoclonal antibodies that do show great promise. So since it received its emergency use authorization from the FDA last year, Ballad Health has been fortunate enough to provide 2,084 infusions of monoclonal antibodies to date. As the cases increase, obviously, so does the demand for this treatment. As we shared last week, we opened our standalone monoclonal infusion site center in Johnson City, which joins the first outpatient infusion site that we opened in Kingsport last month. It's a very convenient way to receive this treatment. The service is available by appointment only, and you have to have your physician's referral and orders. Patients can typically get an appointment for treatment within 24 hours of receiving those orders from their physician. But please remember, they are not preventative, and monoclonal antibodies are not a replacement for the vaccine. We ask that you do all that you can to protect yourself, your family, and our community during this time. I do want to spend a little bit of time talking about flu shots. It is certainly time that we start having that discussion, as we do at this time every single year. You know, it's hard to think back that in February 2020, barely a month into this crisis, we were still battling flu. From September to February of that year, we saw 2,393 patients for flu infections and complications, with as many as 297 in 1 week. Flu is not as deadly as COVID-19 for most people, but it can and still does result in death. In the United States that year, there were 10,000 flu-related deaths. It pales in comparison to the 662,000 deaths in the U.S. from COVID-19, but I'm here to remind you that it's a preventable illness, and a preventable illness that can be deadly if we do not take every step to mitigate the spread of flu as well. Like COVID-19, there is a vaccine for flu that is safe, effective, and widely available. Flu shots are available in pharmacies, and it's critical that everyone who can get one just as soon as they can. If you're fully vaccinated against COVID-19, it's still important to get your flu vaccine. I've had that question a lot. It's important to get both vaccines. They both cause respiratory illnesses, but they are different viruses. Pharmacies, CVS, Walgreens, local pharmacies, your physician's offices, everyone is now getting their flu shots. The CDC recommends a flu shot for everyone 6 months and older. There's just different variations. There's egg-free. If you have that egg allergy, you can get your flu shot. There's a high dose for seniors. So lots of options out there. Get the vaccine that's right and available to you. You can help us stave off a very difficult winter. If we have flu and COVID circulating, it will prove very difficult. I'm asking you to go get your flu shot between now and October. That's all I have, so I will turn it back over to Eric.
Jamie, can you address just, people may ask, they get the vaccine and the flu shot at the same time, just.
Yeah, so just real quickly, people have asked about getting the timing of flu shots and COVID vaccines. You can get the flu vaccine and the COVID vaccine at the same time. So there previously had been some wait period for multiple vaccines, but now the COVID vaccine is safe, it's effective, and they know that you can get any vaccine, from your flu vaccine to your childhood vaccines. If your child needs to be caught up, you can get those at the same time.
Great, thank you, Jamie. We can open it up for questions now.
We're running a little ahead of schedule, so let's do 3 each. Start with Bianca.
Okay, so last December, we saw twice as many cases as last January, but in January, though the cases dropped, the deaths obviously rose as a slight lagging indicator. Are the death numbers beginning to reach the peak of cases that we saw just a few weeks ago, or are we even at like a peak death rate, so to speak, yet?
Well, it appears that the Delta variant has created, I think, a sicker patient in the facilities, and so I think we are going to continue to see an increase in deaths. So I don't think we hit that peak yet, just because I don't think we've seen a peak in a number of cases that we have. So as the number of cases continues to increase, the number of inpatients continues to increase, we see additional deaths as a result of that, unfortunately.
So as we keep seeing that peak, it's not really gone down yet. How long after we come down from this peak that we're currently in, that we start seeing deaths spike? So will death counts essentially keep going up and up and up for how long?
Yeah, so what happens is that, I don't want to be callous when I say this, but deaths are a lagging indicator of what's happening. You typically have a large number of cases, then you have hospitalizations, and then you have deaths as a result of that. So that's obviously the last indicator as a part of this. So even when we see our cases start to decline, we can see deaths continue to increase over time.
All right, switching gears just a little bit. With higher case counts, obviously we're seeing more and more numbers of breakthrough cases of fully vaccinated folks getting contracting COVID-19. But percentage-wise, are we seeing more hospitalized patients who are fully vaccinated? Not just the actual number, but the percentage.
I think the percentage is starting pretty close to around 93% or so of the people. I'm just checking with Jamie, I'm accurate with that. That around 93% of the people who are hospitalized are not vaccinated. So that number is staying pretty consistent with where we were before. And then obviously the higher percentage for those not vaccinated is in the ICU, and the same with those being on ventilators.
Lydia?
Since she had mentioned death rates, I do have a question related to that. Though we're at higher hospitalizations than we were in the winter, and we're at higher ICU patients, the deaths are about half of what it was last time. Any idea what's going on there?
Are you saying the deaths are higher than they were last time,
The lower.
or lower?
Yeah,
I think
we're
we're actually,
about 40, 50.
yeah, I think we're actually approaching to the total deaths close where we were at our peak before. So I will say, comparing to cases now, hospitalizations is a little bit different, but comparing overall cases, I think one thing that's happening is that the monoclonal antibody, that effect is having, I guess, a really positive effect on treating people sooner. So that's typically done within 7 to 10 days of being diagnosed with COVID-19. So we're seeing that intervention happening. So that could be the reason why we're seeing fewer deaths also compared to the number of cases.
And any idea what's driving the flattening of the past couple of days?
I don't. I think it's just, I said earlier, we do see peaks and valleys with this. We're very thankful for it. If we're seeing a flattening, it does give our team members some relief that's out there. I'm afraid that we will see it increase again because just the number of cases that we're seeing. We do believe that the Safer at Home program, we do believe that the monoclonal antibodies, as we've really started to push that out more and more, is really making an impact on the number of patients that are hospitalized.
And then finally, talking about vaccine mandates, on the national stage, there was a hospital in New York State that had to stop deliveries because they had lost quite a couple dozen team members from the vaccine mandate. Do you have any kind of indication if a mandate was put in place here, what might occur as far as folks leaving because of it?
Yeah, I think we've heard advocates from both sides of that, people who really think it's important that we do have a mask mandate, and those who do not want to have that. So I think we would lose team members as a result of a mask mandate, so we're concerned about that. So at this point, that's why we're just waiting to see what the federal guidelines are asking us to do. At this point, though, we're not making any mask mandate, but obviously we have to have every team member we can taking care of our patients because of that very high number of cases that we have.
Vaccinated.
What I say?
Mask.
I'm sorry, yeah, vaccination, sorry.
But do you have an idea of a number?
No, I don't.
Thank you.
Dave?
To what do you attribute the sharp decline in pediatric cases?
You want to take that one?
Sure.
I'll let the medical folks take that.
Our pediatric cases have done well. They've been in-house, but typically with pediatric cases, they're going to respond well. And so they've been sick enough to be hospitalized. Some of them have been with us for several days, but thankfully we've also been able to treat those patients and get them discharged back home.
Kind of as a follow-up to that, the state of Tennessee is reporting about a third of the cases in this part of the state, in your 10-county area, are school-age children. But we don't see the pediatric numbers. I'm just wondering, how does that translate in terms of the patients that you're seeing, and are some of these safer at home patients, pediatric cases?
I'm not sure we have any pediatrics in safer at home. I can tell you of the cases that valid diagnosis, it ranges anywhere, so the cases that are tested through us, that urgent cares, wherever it may be, ranges anywhere from 20 to 40% have been pediatrics. That's come down over the last week to run about 15% of our daily positives are pediatrics. And it brings back home that conversation that I think we had last week, watching for those MIS-C cases. So with this many kids that have been diagnosed positive in the region, it's really important for parents to be aware of MIS-C, to know what symptoms to watch for, and to seek care.
We have seen some MIS-C.
I think we've reported 2 MIS-Cs just in the last couple of weeks, and we are projecting that we'll see more admissions with MIS-C.
Okay. I got one more. So we've had a lot of events in the area. Typically, if you have a large public event, when do you typically see an uptick in cases? If there's going to be an uptick, when is that? Is it 2 or 3 days, a week? What's the timeline on that?
It's usually going to be within that first week. Sometimes it will bleed over into that second week. So you'll have your first wave of cases anywhere from 3 to 5 days after the actual event. And then it just depends on how large, how many people were actually positive, how many secondary cases you have off. So, an event can lead to multiple secondary cases throughout the weeks. And so that's something you may not see, and we typically don't see an event and a huge spike. But what you may see is a little stair step here, and then you have secondary cases from the next week, and so it just continues to build in the community.
So it's kind of a stair step kind of thing.
For the most part.
Thanks.
Gotcha. Building on some of those pediatrics questions, Jamie might want to stay up, I'm sorry.
I'm tired.
But I am curious as to what's kind of the turnaround rate for those children who are hospitalized. I think if they're not hospitalized typically as long as the adults are, but how quickly are they coming in and eventually being discharged?
It's the same thing with adults. We're seeing hospitalized kids come in needing care anywhere from 3 days after their test to some up to 10. And so it really just depends on the child, their risk factors, and the various things. Hospitalizations have been the same way. Some have been able, the team has been able to stabilize and discharge in a couple of days. We've had several that have been 10 days with us, and then obviously, are a couple that have been over 44 days. And so it really is, it's one thing I say about COVID, it is so very specific to the individual. Some people can have extremely mild illness, and some people can be extremely sick. Some people can have GI symptoms, and some people can have respiratory symptoms. There really is this is what's going to happen from admission to discharge.
Gotcha. Something about the average age of hospitalizations that I noticed. It looks like the average age of those vaccinated has fallen quite a bit in the last week. I think at least 4 to 6 years. Is that just because some of the older patients have either been discharged or maybe unfortunately passed on, or is this starting to trend younger in vaccinated people?
We are definitely seeing that it is our those vaccinated people are typically, so the vaccinated people are typically older, even in our hospitalizations. It's the unvaccinated that we're seeing that number go down, and that is by far a product of community spread and just that age group. They're out and about, they're at work, they're at children's events, and so you really are seeing a younger age of the unvaccinated.
Yeah, you see the younger age groups are not vaccinated as much as the older age groups.
Yeah, no, I understand that.
Yeah.
I was just curious because the average age of the vaccinated people hospitalized has trended down, at least in the last week, maybe in the last couple of weeks, down to the low 70s when I think it was in the upper 70s before. I was just wondering if that was, just a happenstance based on the age of people, or?
I don't know the answer to that. We'd have to dig into the data a little bit more on that one.
Gotcha. Last thing I have for y'all, I know that last year's surge being kind of driven by a lot of holidays is not lost on you. We're nearing the holidays again. I know Halloween seemed to be a little bit of a kickstart last year. How far ahead are you guys planning for the holidays, and what kind of things are you doing to be ready for even another possible surge as we get closer to those holidays?
Well, our modeling really does think about holidays, activities, things like that. One thing that's a little different now, and we talk about this pretty often in our operations team, is last year we had a lot of mitigation strategies going on. There were mask mandates. There were people stayed at home a lot more. Now there's very few, if any, mitigation really happening. So part of our discussion is there may not be those sharp increases because it's already happening kind of day by day basis. So we're actually working through that with the modeling right now. That even though now I think one thing that could see an increase is moving back inside, especially sporting events, and as the weather gets colder, people will start moving back inside. That we could see more spread of COVID-19 and see increasing cases that way. But right now we're modeling probably about 3 to 4 weeks out at a time. So the holidays really haven't come into play. We will continue to do the same thing we've done before through create capacity. We're still holding on elective cases. We would like to get those started again, but right now we just cannot do that because of the pressure we have on our staff and on just the total number of patients in our hospitals today. And so before, I think 20% of our COVID cases was kind of our test of when we could start back to elective procedures. We're still running right at 30% of our total census is related to COVID.
Thank you.
Open it up to those of you on the phone. We are going to start with Richard.
Yes, talking about large events coming up, we just had Rhythm and Roots. You've got race week at Bristol. Granted, it's outside, but what kind of concern are you all looking at there?
The question was around events, especially we had Rhythm and Roots last weekend, and then we have Bristol Motor Speedway have a race coming up. Now, we're always concerned with large gatherings, whether it's these events or any other events. So what we tell people, Richard, is that they need to, if you're going to an event, I would want to be vaccinated. I think that would be very important that you're vaccinated if you're getting into large crowds. I would wear a mask if you cannot socially distance appropriately. I think all those things we talked about before, washing your hands, all those things just to stop the mitigation. Since there are no mandates regarding that today, you have to take some personal responsibility on these issues and really make sure you're protecting yourself and your family.
Okay, I have one more. This may be Jamie's. The flu season is, I guess, ending in the southern hemisphere. Have you all received any guidance or anything on how bad it's been down there?
Yeah, so the question is about the southern hemisphere ending their flu season. And what we've seen is it's been a very mild season, and that's similar to last year in the southern hemisphere. We do think some of that may be related to mask mandates and lockdowns in some of those countries. And so we're watching it, but I think we may have a very different picture of mitigation measures in the region. So it's a little harder to predict what's going to happen this year.
Okay, great. Thank you.
All right. Thanks, Richard. Spencer?
Yeah, so people are going to see these numbers and see that the hospital and there's not going to be, as much pressure on hospitals moving forward, but 396 patients is still extremely high. You all are still going to be quite pressed for the foreseeable future. Is that correct?
Yeah, we're still, and I would probably say the question was, with the cases, inpatient cases going down, will people see this as that it's really kind of backing off and that maybe we're seeing a decline in this? We still, I don't know if it really decreased as much as it kind of flattened. So it's going to be more of a flattening of our inpatients. We're still, like I just said, we're still at 30% or more of our total 1,300 patients are COVID-19 patients. So it's still a lot of pressure. And also remember that these patients, as I said earlier, these patients require a lot of attention, a lot of monitoring, a lot of resources, not only from our team members, but just from a supply issue as well. So there's continued a fairly high amount of support we have to provide for the COVID-19 patients, and we'll continue to do that. But 380, 390 is still a very high number for us across our system.
Yeah, so we're still obviously in a surge here. How long, I know you have your modeling and everything that goes out for the next week or two, but how long do you think that this is going to carry on in the region, regardless of vaccination rates, I guess, because if those continue to sort of stay stagnant?
So the question is, how much longer is our cases, are they going to increase, continue on like they are today, and inpatients, are they going to start to decline? That, I don't know that we have an answer for that yet, because we are still seeing an increase in cases across our region. Our modeling is usually done about 2 to 3 weeks in advance. We still continue to see, based on our modeling, an increase in cases for the next 2 to 3 weeks from an inpatient standpoint. I will say that looking at some things happening across the state of Tennessee and Virginia, we are starting to see some leveling of cases happen and maybe some decreases in some places. Virginia, there are more mask mandates going on in Virginia, so more of a decline there. Across Tennessee, I think we have seen some decline on the western part of the state. And typically for us, it goes from west to east. And so we just don't know at this point, because we continue to see an increase in cases today.
All righty, thank you.
Okay, Spencer, anything else?
I don't believe so.
Okay, then that concludes today's briefing. Thank you all.
Thank you all very much. Appreciate it.